An ounce of prevention is worth a pound of cure. This timeless quote by Benjamin Franklin rings especially true in nursing care. Preventing pressure ulcers is not only more effective than treating them, it's more humane. These wounds cause pains, increase hospital stays, and lead to serious complications. But the good news is many of them are preventable with something as simple and fundamental as nutrition. My credibility related to this topic is rooted in my personal and clinical experience. As a nursing student who has directly dealt with immobilized patients, I've seen the difference that proper nutrition can make on a person's body. It's not just in the healing, but it actually prevents wounds before it starts. In today's demonstration, I'll show you a few simple dietary changes that can support your skin's integrity, can help avoid one of the most common preventable complications like pressure ulcers, and it can overall help you feel better. Starting off with one of the strongest topics we have is nutrition. Nutrition is very important for your overall body and your overall health, and being undernourished is a big risk factor. According to the Journal of Wound, Ostomy, and Continence Nursing, malnutrition is one of the most significant risk factors for pressure injury development and delayed healing, meaning that if you cut yourself, your skin is more likely to take longer to heal because you've been malnourished. When patients are undernourished, their skin becomes more fragile and their ability to heal becomes greatly compromised. So when elderly people take a fall and they're malnourished and they haven't been getting their nutrients, their knee is going to take longer to heal. Same thing with, you can see it in younger people as well. If you're malnourished, you're going to start seeing more symptoms of having a cold or, a weakened immune system just because you might not be getting all the nutrients that you need. Speaking from my personal and clinical experience, I've seen that high protein meals and snack can greatly improve healing outcomes. Eating your vegetables, eating your meats, making sure you get your daily nutrients for the day can really overall help a patient feel better way quicker than without. But it's not just protein. According to the National Pressure Injury Advisory Panel, patients at risk should receive adequate protein, zinc, and vitamin C. All of these contribute to the repair of tissues, immune function, and overall collagen production. So all of these blended together will give you the ultimate combination for the healthiest skin and the strongest immune system and enough protein so if anything does get damaged, your tissue can repair itself. Go into the specifics of these. Vitamin C helps form collagen, which is essential for skin strength. It makes your skin more elastic. Zinc supports immune system, skin renewal. Protein fuels your muscles and provides tissue repair. All of this is to say that prevention starts at the table. Our role as nurses isn't just to react to wounds, it's to prevent them. So we should be able to give knowledge to our patients on how to prevent them from common cases of pressure injuries because you're not getting enough vitamins or you're not getting enough nutrition. That is our role as nurses to give that information to our patients. According to the Academy of Nutrition and Dietetics, assessing patients' nutritional status should be a part of every skin assessment, especially dealing with elderly patients. That means looking for signs of weight loss, looking for poor appetite, or maybe their lab results suggest that they're in a state of malnutrition. It's really important for us as nurses to keep an eye on this because overall, this could help them and we could be the one thing that's standing between them and a preventable injury. Then we will work with the care team that provides nutritional support, supplements, enriched meals, and dietary referrals. Let's look at some healthy, food-based, ultra nutritious, food-based practices that I can show you guys that would be recommended to you guys that have everything that we're pretty much looking for and talking about. Now, I'm going to demonstrate how to make a Greek yogurt smoothie with added protein, mixed berries, and mangoes. So, the first thing you're going to start off with is non-fat plain Greek yogurt. Now, Greek yogurt adds protein. It has 10 grams in this one, and this is overall going to help you because we're trying to increase our protein intake. Next thing that comes up is our added protein. Now, you can either choose for this to be a vanilla flavor, or you can choose to have this non-flavored, especially if you don't want to add another flavor to your smoothie. But all of this is going in the blender, okay? The next we're gonna add is our mixed berries. As many as you want, and I prefer them frozen just to make a good smoothie. So you're gonna add your mixed berries, and these are also going to provide some nutrients to us. So this is where we're gonna get our main source of vitamin C. Now, as some of you may know, oranges are a really good source of vitamin C, packed with nutritional value. So we're gonna add some orange juice as our liquid. So we add that in the blender as well. We'll add some honey in our blender, a little bit of sweetness. You'll add some water, make sure to add water, and then you'll mix, 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 mix. Boom. Now you have your berry added protein nutritional smoothie. Okay, so this smoothie is gonna have our vitamin C. This smoothie is gonna have traces of zinc. This smoothie is gonna have protein. So this is definitely going to be good, and adding this into your diet is definitely gonna be that nutritional value you're looking for. This is a really good nutrient dense option for patients who are having trouble chewing, who may have poor appetite, or may just overall have discomfort with solid foods. The next thing I'm going to be demonstrating is a simple citrus salad with pumpkin seeds. Doesn't that sound delicious? The spinach and the oranges provide vitamin C. The pumpkin seeds are a great source of zinc, which will overall help with wound healing and your immune system. Let's get started. So first, you're gonna start with a bag or 2 bags of baby spinach. We'll start with a fresh orange, peeled, diced, sliced, okay? Any way you want to dice it, but you definitely want to make sure you peel this orange. You'll end up doing the same thing with the grapefruit. And the grapefruit, this citrus is just going to add on to the immune system. This is just immune city right here. Then we'll go in with our red onions for a little bit of crunch. And then the main results for zinc would definitely be your pumpkin seeds. This is when we're gonna make our little vinaigrettes, okay? It's a simple salad. So the only thing we'll need for this vinaigrette is we'll need some olive oil, we'll need some lemon, fresh lemon, and then we'll go ahead and need some salt and pepper. And that's pretty much all we're gonna need for this salad. According to clinical nutrition and nursing practice, vitamin C is a necessity for collagen formation, while zinc deficiency impairs immune responses and delays wound healing. So if you really think about it, you're only doing yourself and your future self a disservice by not implementing these things now. Make sure that you're up to date with your vitamin C and your zinc intake and your protein intake. Going with the last, but definitely not the least, skin health equals hydration. Just think about that. Hydration equals skin health. Skin health means you're hydrated, okay? Stick with me. It's so simple that proper hydration is often overlooked. Can you believe that? Let's start off strong. You're gonna go ahead and get your cucumber. You're gonna go ahead and thinly slice it, okay? And get you a big jug of water. Then you're going to take your mint and you're going to finely, finely, finely chop that up. Lemon, we're gonna add our lemon into the water, and this is just basically adding electrolytes in. This is just gonna give your water more of a chance to soak into your skin, soak into your organs. Here's a rundown of what we discussed. Firstly, we talked about how nurses can use and apply this knowledge by assessing nutritional risk and making dietary interventions mandatory. Secondly, we explored how poor nutrition can increase the risk of pressure ulcers and pressure injuries overall. And finally, we identified key nutrients like protein, zinc, vitamin C that maintain your skin integrity and help your skin elasticity, your immune system, and all that good stuff that just keeps the engine running. In conclusion, pressure ulcers are often painful and costly, but they are preventable by uptaking nutrition. So, as nurses, we definitely need to be making sure we do a good job of that and keeping that in mind in the future for overall better healthcare system. Thank you for coming to my speech. I really appreciate it. My name is Faith Obizu, and thank you for listening.